So thank you so much, and we're going to first invite our first speaker up. So I got a pleasure of meeting him, Jomi. He is experienced leader and builder with a decade-plus background in design, product design, and engineering in the healthcare and media space. Photon Health is rebuilding the prescription experience to put patients back in control, making medication prices transparent and truly portable. So we're going to ask Jomi to come on up, and we're excited to hear his talk on why good design isn't optional, even in health.
Thank you so much. Oh man, that photo's like 15 years ago. How you doing? So the title of my talk is Design is Hospitality, and with the caveat, why good design isn't optional, especially in healthcare. You're good. How are we doing today? There you go. All right, so hello again. My name is Jomi, and I was already introduced, but next slide. So yeah, I've been working in design, and I've been a design leader for a while now. The last almost 6 years have been in healthcare. Before that, I spent a lot of time in media, in brand, and in culture. So kind of like bringing what I've learned, a lot of it is in kind of like, the magazine world. Bringing that same consumer experience into healthcare is something that I'm really passionate about. And yeah, as they mentioned, I'm the head of design and marketplace product lead at Photon Health. And really quickly about Photon. So Photon, we let patients shop for prescriptions. We're a prescription marketplace. So if you ever go to the doctor, I know there's some doctors in the house, they usually ask you like, what's your preferred pharmacy or what's your pharmacy around you? Photon basically changes that entire process where the patient owns their prescriptions. So when the doctor writes you a prescription, the patient gets a text, and then they can select the pharmacy and see the prices in advance, see like, is this going to be in stock? Is it, when is it going to be delivered? So just basically bringing that consumer experience that we've known for a while now in consumer apps, Uber, DoorDash, Instacart. These are basic experiences, but it's not the same in healthcare. And there's a lot of reasons why we're not going to get into it today, but we're just trying to bring that same consumer experience so the patient is in control. Yeah, shouts to the Photon team over here. And the themes that I'm going to be talking about is these three, like anticipate, orchestrate, and elevate. And before I get into these deeply, next slide, please. I'm going to be talking about like why hospitality. So, hospitality, healthcare. Oh man, why? So I was reading this book, Unreasonable Hospitality by Will Guidara. He was the general manager and owner, eventually co-owner of 11 Madison Park, which was the #1 restaurant in the world in 2017. If you've seen The Bear, there's an episode where Richie just stodges and cleans spoons for an entire episode. That is based on 11 Madison Park. And I'm going to be talking about how do we bring this hospitality into healthcare through design? Next slide, please. So what is hospitality? And next slide. Sorry, it's a lot of slides. I'm a designer. It's my, I gotta do it this way. So the Latin word hospitalitas means friendliness to guests, or the act of receiving a guest. And the noun, next slide please, hospes means, there you go, perfect, hey, means both guest and host, suggesting a reciprocal relationship. So the root word is actually ghosti, so it's like guest and host are in that one word. But we forget this now. But I really want to highlight this reciprocal relationship. There's a reason for that. And there's the words host, hostel, hotel, hospital, and hospitality come from this word. So when I said reciprocal, the meaning has this mutual obligation, sacred duty, and moral virtue. Like that's the essence of the word hospitality. And in ancient Europe and some parts of Asia, it's actually, you consider it a moral duty to basically take someone in, like a stranger, and basically feed them, give them a home. Obviously that's not going to work in modern times, but during those times that was the essence of the word. And the reason is because if something happened to you, you would expect someone to pay that forward. And mutual, sacred, and moral, I don't know if you hear those terms in healthcare these days, but I just wanted, this talk is really about like how do we get back to these ideas and how do we manifest it through design. So the first theme is anticipate. So find the parking meter so guests can enjoy dinner. So an example from 11 Madison Park, actually from Union Square Cafe, where Will Guidara first worked. Something that they found is like there was this lady who was eating dinner and she wanted to get up mid-meal so that she could put quarters. This is back in the day, so there's no apps back then, but she wanted to put quarters in her parking meter. And they're like, which one's your car? We're just going to do it for you. And then they figured out, why don't we just like standardize this? So this is what they call in hospitality a grace note, which is something to just like elevate your experience by a little bit. And so Will Guidara, the reason he wrote this book is because he wanted to really differentiate what hospitality is. Service is just doing this transactional thing. You asked me to do something, you paid me for it, I give it to you. But hospitality is just a level above. And that basically became the theme of Union Square Cafe and eventually 11 Madison Park. So what's the reason for how do we apply this into healthcare? Sorry. Am I pressing the right button? Sorry. It's my bad. Yeah. All right, so we apply this in healthcare to see the need before the guest asks. Sorry, I'm covering it. And how we apply this in Photon is, so I'm not even showing you the product. I'm showing you just the obsession that we have with our SMS messages, and we're continuing to refine this today. But we had a version before when we launched, and then eventually what we found out is like, people would reply to us, but we're like, why would you have to reply to us if you can self-serve yourself? So we had to redesign the anatomy of a status update. And again, right, we're introducing a new behavior to patients. Why do I have to choose a pharmacy using an SMS? What do I get by doing that? What can I expect afterwards? So all these questions we had to compact in 150 characters that works for every US cellular service. And this is what we came up with. And again, we're constantly refining this. But every stage of the process, the point is the patient is not wondering what's going to happen next. You set the stage, very similar to the parking the meter example, even if they don't ask for it. And it turns out that this is something that's really valuable. So to just summarize that, you anticipate the anxiety, you eliminate it before it becomes a problem, and then you standardize the grace note. So again, I think everyone thinks of design as like interfaces, but design is literally every touch point of the patient's experience. So the next theme is Orchestrate. So finish strong, the 1-inch rule. So in 11 Madison Park, they have this thing called the 1-inch rule. So when the idea is the person who is plating the dish in front of you, you are part of a long line of a lot of people. Someone sourced the ingredients. There's chefs who train for years who cook the food. There's all this complexity that's happening in the kitchen. And there is a server who had to tell you the story of what the ingredients are. And as the last person in the line, you can't mess it up. If that zucchini flour gets thrown off, you've basically, I don't want to say ruined the experience, but they trust you to basically finish strong. And this idea is just about how do we follow through? And I think so much of design, not just in healthcare, but maybe especially in healthcare, we don't really think about the ultimate end experience. Sometimes it just ends at, when someone pays a bill or when you discharge them. But what about afterwards? So this is just how do we think about those moments? And in how do we apply this in design? And it's own the handoff so the guest never feels the kitchen. As I mentioned, if you've seen The Bear, it's chaotic. It's absolute chaos and madness. But the point is the guest never sees all of that. All they care about is they got the right thing at the right time and the food is delicious. So it's on us, the builders, to basically figure out all that complexity so the patient just enjoys their meal. And how we did that at Photon is, we map the process and question each part. So again, like this is what design is to me. You don't have to understand the details of the diagram, but the point is you outline every single part of the step, and then you question it. Do we need it? Do we update it? Do we change it? Is it actually necessary? How do we elevate it? And only through that can you eventually design how the entire system should work. So this is to me what real design is. This is the hard work. I know it's like laid out really nicely, but the point is, like in prescriptions, there's basically a few scenarios. Everything goes well. There's an issue and the patient needs to do something, or there's an issue and the patient doesn't need to do something, they just have to wait, but you inform them. So all these things that happen around prescriptions, out of stock, back ordered, prior auth needed, prescription clarification needed, we just collapse all these scenarios into these 3 or 4 buckets, and then we figure out what the experience is after that. And then the next thing is we build tools to solve the biggest issues. So at Photon we have internal tooling that basically human agents and AI agents go through to process every order. Whether we have 1 order or we have 1,000 orders at any given time, we just give people tools in order to process all of them. And again, this is to me like what design is. It's like you have to figure out the operations behind the scenes in order to deliver the experience that you do. I know kitchens are known for the chefs, but there's all these other people that work in that system to make the thing happen, and it's a choreography. And lastly, you communicate just enough at the right time. So you notice here that it's like this part, this is what people think what design is, but to me as a designer, it's actually all the other stuff. This becomes easier when you figured out all the other stuff. Because there's 1,000 ways to design a screen, the hierarchy, the typography, like the copy, but you obsess over you can't get to this part without obsessing over the other stuff. So that's what orchestration is. And remember, it's like you have to follow through. It's like from start all the way to the finish. And then the last part is elevate. So how do you add human touches that deliver? So at 11 Madison Park, they have this concept of a 1+ card. And what they've noticed is that there's patterns that guests ask them questions about specific things in the restaurant. Where did you get the cheese? What painting is that? And the most common one was people were so interested in who made the plates, and they would always like turn it over just to see like who made their plates. So what 11 Madison Park did is they printed these index cards. It's refined, heavy paper, great typography, great design, and they would hand it out to the guests when they see or when they ask a question. And that little moment is what they remember and not even the meal. So that's another thing that I want to kind of like emphasize here, is that sometimes you think it's all the service, but sometimes it's actually just that one level above of elevating the experience that someone really remembers. And how do we, how do we do that in healthcare? So how we did this at Photon is big moments from tiny, reliable details. So if I'm to be honest with you, like as a designer, the design isn't overly complex. It's like very simple, but it's just about how do you deliver the right information and the right details at the right time. So you see here, we partner with Amazon Pharmacy. We have, you can see the price of your prescription. And remember, we have the prescription in hand. This is not separate from, basically if you select Amazon Pharmacy, we send the prescription directly to Amazon Pharmacy, and you know exactly how much you're going to pay. You know when you're going to get it, and you know that it's in stock for all kinds of prescriptions. And then we ask you, when do you need your order by? And then we generate a coupon card for you. If you basically, this is the cheapest way to pay cash for your prescription. So, someone might say, like, why do you need to do this? Like, you can go to GoodRx, you can go to Amazon Pharmacy and figure all this out. But to us, it's about collapsing all of those details into one experience so that it's elevated than their standard one. Remember that these people are already sick, right? Or someone who needs care. And so to us, it's like anything where you can just reduce the friction just by a little bit means a lot to us. And we're going to continue to refine this further and further. I like to say that, why I love design is the user, there's no upper bound to user experience. The ideal experience is I'm not sick, right? But the reality is people get sick. So to us, it's just how do we make that experience a little bit better? So to summarize the talk, It's anticipate, so that prevents problems before they start. It's orchestrate, which makes the messy work invisible and reliable. You elevate, and that's using small, well-timed human touches to lower stress and expedite people to the outcome that they actually care about. And my challenge for you all is find the one thing, and whatever you do, if you're in healthcare, you're in technology, find one thing in your entire process that you can design better and subtract it to its utmost essence and deliver hospitality. You anticipate, you orchestrate, and then you elevate. And then before I say goodbye, the one last thing I'm going to say is design is a team sport. Just like one chef does not make a restaurant, one designer does not make a company. So much of it is about how do you develop a culture of hospitality. If you say our products are this way, our products are that way, that's a culture thing. It's not a designer thing, it's not an engineering thing, it's not a CEO thing. It's everyone combined making that thing happen. And thanks.